Today we're meeting with Deep TMS patient Kristi Rosenblum, who was treated by Pasadena Neuropsychiatry and TMS Center to wrap our hashtag Getting Deep campaign for Depression Awareness Month, where we have been getting deep and asking patients to share their mental health journeys to inspire others. Although we're nearing the end of this special observance month, the conversation doesn't and shouldn't stop here. And in hopes of keeping the conversation going, Kristi has kindly and generously agreed to answer a few of the most frequently asked questions around depression and deep TMS. For those who are unaware, deep TMS is short for deep transcranial magnetic stimulation, a non-invasive treatment that is FDA cleared for depression, anxious depression, obsessive compulsive disorder, or OCD, and as a safe and effective aid for short-term smoking cessation in adults. The treatment uses magnetic waves to stimulate deep parts of the brain associated with symptoms of these brain disorders. Deep TMS is used by providers across the world, including all major markets in the US alone. Kristi, thank you so much for taking the time to meet today and to share your mental health journey and experience with Deep TMS. To kick us off, can you share a little bit of your backstory and mental health journey?
My pleasure. Let's see, a couple of years ago, I went through several big transitions in my life. I was a kindergarten teacher for 20 years, and they moved me to second grade. I moved my mom with Alzheimer's disease into my home so I could help take care of her. I got pregnant and miscarried. I had a rather difficult falling out with one of my best girlfriends who I taught with for 20 years. And I just plummeted and became so depressed that getting out of bed and doing things like brushing my teeth and showering just became really difficult. And I came to Dr. Seppa. For about 6 to 8 months, I would come in and I would have a dip in my depression again. And when I dipped, it was difficult, and I would come back to Dr. Seppa and share the information, and she would adjust some medication and we would talk, and then I would be good for several months. And just about 4 or 5 months ago, I dipped really low. I I put on weight. I was really depressed. And at that point, I had tried, I don't know, maybe 5 or 6 different psychiatric meds. And this is when Dr. Seppa started talking to me about DTMS. At my appointment, she said, I think that you would be a really good candidate for it because your depression seems to be medication resistant.
And so how was your experience with Deep TMS?
After 4 treatments, I actually started to feel a little bit better. And then after 2 weeks, I felt even better. And then after 3 weeks, I felt even better. And by about a month in, I felt back to myself. It's amazing.
That's spectacular. That's unbelievable. What do you like to do during those 20 minutes a day?
Either close my eyes and relax. She has a TV in there and I can play, nature sounds or whatnot. And sometimes I just work on my cell phone, but it doesn't hurt. It's almost like therapeutic and relaxing. So after each treatment, they just take the helmet off. I fix my hair a little bit and I'm out the door, going about my day in a normal way.
What's your advice for people who are going through depression or any mental illness? Do you have any advice for them? Any words of hope?
It would be my hope that more people that were depressed and patients that are seeing somebody had the information about DTMS and had access to the information and could hear about other people's experiences with it, because it's just absolutely given me my life back.
I think that you being able to speak out, first of all, supports Brainsway's mission to destigmatize mental illness. Mental illness is like any other illness, and people should be, talking about it, going out and seeking help. So thank you so much for your willingness and your openness and your honesty to share. And to all of those watching and to our followers, you can visit brainsway.com, find a provider. Like Kristi said, it's so important to find a doctor that you can trust. And there are a lot of doctors all over the country who offer Deep TMS. So feel free to visit the website to find a provider near you.